people and society and cultures that have created and spun vanity around this profession. They've attached shame to it. And in my opinion, that's where we've gotten it wrong. Plastic surgery is actually one of the most self-empowering things that you can do for yourself when it's done for the right. Hey, my name is Dr. Nicholas Howland. I'm a board-certified plastic surgeon here in Draper, Utah. I get asked a lot of times why I went into plastic surgery. And I just want to share with you today a little bit of my story of why I went into plastic surgery, what some of my thoughts are on plastic surgery. So years ago, back in 2011, so I trained in medical school from 2007 to 11, and then residency was 2011 to 2017. So 10 years of medical training and residency program, 4 years of undergraduate before that, 14 years of schooling altogether. Going into medical school and residency, I knew that I wanted to be a surgeon. I didn't know what kind of surgeon, but surgery was always what I wanted to do. I'm the oldest of 4 sons. I've got a sister at each end, but I was the man of the house. And my dad had a really successful commercial real estate business, and my job as the oldest son was to take that business over. And I didn't want to. In fact, I did commercial real estate all through undergraduate training, and I hated it. Made great money and hated it. And then when I went to my dad and I said, you know what, Dad, my undergraduate training is coming to an end. I've got a business degree, but I've also taken all of these pre-med classes and not told you about them. I'm gonna go into medicine. I'm gonna go to medical school. I've gotten accepted, and that is my path. And my dad looked at me and he said, you're an idiot, and I'm not paying for that shit. And then he said something that actually was really profound. He said, there are much better ways to make money, which turns out he's right. Like 100%, as I've gone through all of this, he was absolutely right. There are much better ways to make money. But he also did a few things that became really big gifts in my life. He made me go after that dream, and he didn't cover it. He didn't say, great, I'm gonna set you up. We're gonna make sure you get through this. He made me work and scrape by, figure out how to live life as a resident, take out student loans, and figure out how to pursue this dream. Now, that's a whole other story. What I want to talk to you though is plastic surgery and how I came into that. So I go into medical school. I've followed now a couple of different surgeons around. I followed an orthopedic surgeon around. I watched him do about 10 ACL repairs all in one day, or 2 days. After the second day, bored out of my mind. I followed a bariatric surgeon around. Bariatric surgeons do weight loss surgeries like stomach stapling, gastric bypasses, Roux-en-Y's. After about 5 or 6 of those over a couple days, bored out of my mind. And for a second, I had this moment where I was like, maybe a surgery's not for me. Like, these guys just do the same thing over and over. This seems way too monotonous for my monkey squirrel brain that's going on all the time. And I then found plastic surgery. And every surgery that I saw just was completely unique and different. Even if it was the same surgery, like 2 breast augmentations could be wildly different because of the architecture of the breast, the chest, the implants that needed to be chosen, whether a lift needed to be done or not done, whether fat grafting needed to be added. And so people all the time will ask me, well, why'd you go into plastic surgery? And I tell them ADHD. Like, plastic surgery was just the first field that held my attention. But I also was in love. Like, it was everything I wanted to do. And every time I was in the operating room, I was excited to be there. A few years later, as I'm going down this path, I've now done research with a plastic surgeon at my medical school. I'm setting myself up to be able to get into a really difficult residency program in plastic surgery. And we go out to dinner with some friends. One of these friends was a very prominent church member at the church that I was in at the time. And he said, hey, what did you decide to go into? This is like 4th year medical school. Is what are you going into when you go to residency next year? And I looked at him and I said, I'm gonna go into plastic surgery. Really excited. And he kind of stopped and he just looked at me and he says, oh, what a shame. And I was like, what? What do you mean, what a shame? It is, well, it's so sad that our healthcare system has gotten so bad that in order to make a living, you have to go into such a vain and terrible profession like plastic surgery. And I'm going here like, whoa, like, I like this field. This is not vanity or terrible for me. I like it. But that was the first time that I had ever really been introduced to the shame that is oftentimes attached to plastic surgery. A couple years later, I would kind of see this again when my mom started calling me after my days at the hospital as a resident. And she would call me up and she would ask me the same question every day. She would say, "Did you do good plastic surgery today? Or did you do bad plastic surgery today?" And it seems like a silly question, but in her mind, if I was doing cleft lips and palates, burn reconstruction, big wound repairs, I was saving the world. And that was the good plastic surgery. But if I was doing nose jobs, tummy tucks, breast augmentations, anything considered cosmetic, that was bad plastic surgery. And for me, I never ever saw the difference between the two. I have seen a breast augmentation change a woman's life just as significantly as a cleft palate operation did for a kid in Guatemala. Plastic surgery, in my opinion, has nothing to do with vanity. It can, and there are certainly people and society and cultures that have created and spun vanity around this profession. They've attached shame to it. And in my opinion, that's where we've gotten it wrong. Plastic surgery is actually one of the most self-empowering things that you can do for yourself when it's done for the right reason. That's the key point here, because I've gone on podcasts, TV shows, into interviews, into business meetings, and said those exact words. I don't see anything vain about plastic surgery, and I oftentimes get laughed at. And the point is that plastic surgery, when done for the right reason, is actually one of the most self-empowering things you can do for yourself. It helps people see on the outside how they feel on the inside. One more quick story around that, and then we'll wrap up this little why I became a plastic surgeon and my philosophy on plastic surgery. I started a podcast a couple years ago. It's called the Naked Patient Podcast. My patient Mary came on. She wanted to share her story. And at this point, I had no idea really what her story was. I just knew that I had done several procedures for her after she'd lost 100 pounds after bariatric surgery. And she said, "I'd love to come on and share my story." And I said, "Great." I have always believed this whole no shame in plastic surgery, it's self-empowering, all of that. But I also created this podcast because I wanted to know if plastic surgery changed people's lives. And that was the whole point, was bring on patients, ask them about their journey, and then really get the emotional side of it. Did plastic surgery change your life? So Mary comes on, she starts to share her story with me. Mary had been in an abusive relationship, had 2 children with this man, and COVID came around. With COVID happening, things continued to get progressively worse in their relationship. One thing that you have to understand about Mary is when she first married this man, she was fairly thin, and she would oftentimes get looked at or flirted with in public, and he would get angry. And so she made a conscious decision to gain weight in order to avoid getting flirted with or having men talk to her. She thought, well, if I just put on weight, people won't be attracted to me and I won't have to deal with this abuse. And so she did that. But with COVID, the abuse continued to get worse and worse, and she finally made a choice. I need to leave this person. So she packed up the 2 boys, she put their stuff in the car, she packed herself up, and she went in to get her bag out of the house after loading the boys in the car. And her husband was in there, and she finally said, "Hey, I have made the choice that I'm leaving. I'm taking the boys, and I just can't be in this marriage anymore." Her husband grabbed a gun and shot himself in front of her. And the boys heard the gunshot, came running into the house, saw the scene, and that was what she was left with. He passed away, and she had to now pick up these pieces of 2 young boys witnessing that, her witnessing that, and she started to go through a significant amount of therapy and work to improve her life. She did EMDR therapy, cognitive behavioral therapy, PTSD therapy. She lost over 100 pounds, all of these things to help get over what had happened and to really improve herself. So we did about 3 rounds of surgery for her. We took off all of this extra skin from her arms, her tummy, her breasts, her back, and she looked phenomenal. And we're at her last visit. So I see patients at 1 week, a month, 3 months, usually at a year, but we're at her 3-month visit. And this is where we take photos and we decide how happy they are with the surgery and if there's any tweaks that need to be made. And I walk into the room and Mary is sobbing. And I'm like, oh boy, what do we got to fix? And she looked at me and she says, no, you don't understand. Like, these are happy tears. She said, I finally can see on the outside how I feel on the inside. I've done all this work, gone to all this therapy, and this loose skin and all of this stuff was still a constant reminder to me of all of that I had to overcome. And now I don't see it anymore. That story and that episode for me was such a beautiful confirmation and validation of this thought that there's not shame in plastic surgery. But it also helped me see things from an even different perspective, which is plastic surgery didn't change Mary. And I don't think plastic surgery really changes anybody. Only you can actually change yourself. Mary had done all the work. She had fixed herself here, and me being able to fix the external just helped her see it. So for my patients and for people that come and see me, I tell them that I have a little bit of a unique approach. I'm probably the only plastic surgeon that will tell you nobody needs plastic surgery, which is a terrible business model. But I really believe these things. I really believe that there is no shame in plastic surgery. And I really believe that unless you heal yourself here and here, plastic surgery won't change you. Only you can.